If you're a woman that needs help and needs some wraparound services, we at the Delaware Health Equity Coalition, Dr. Sydney Teal, Dr. Velma Scantleberry, and myself, we'd be more than happy to see you. We are located right in 19802 on Boehner Boulevard. See you soon.
Welcome everyone to Every Woman's Her Health. Tonight's episode is called Her Heart, Her Health. Tonight, we're diving into one of the most important health conversations for women, heart disease. It's the #1 killer of women, yet so many women don't know the signs or how to protect themselves. We will have an incredible lineup of real-life patients and medical experts to break it all down. So let's get into it. Dr. Teal, your host for this evening, and tonight we have a lot of vital information for everyone tonight, so grab a healthy snack, listen up. First, we're going to talk about heart disease, but before we get to that, we're going to thank our sponsors, DHEC. Thank you so much for being a constant support for every woman. All right, well, here we are on the couch with me. I have 3 wonderful people, and I'm going to start on my right and ask for you to introduce yourself.
Good evening. My name is LaToya Saunders. I am from New Jersey, but I've been living in Delaware for the past 30 years.
All right, LaToya, thank you very much.
Hi, I'm Dr. Yolanda Hindley. I'm a cardiologist here in Delaware for the last 10 years, but I'm originally from Florida.
Wonderful.
Nice.
Hello, I'm Sharita Robbins, and I was born and raised here in Wilmington, Delaware.
All right, wonderful. We have a native. This is excellent, so thank you so much. This is fantastic. So we're going to talk about heart disease, but I'm going to tell a personal story first and why this is so important to me personally. So when I was in medical school, I was in my 2nd year of medical school, and I get a phone call. And at that time, I lived in Richmond, because I'm not from Delaware. And I get a call, and it's my mom's job. And they say, Sydney, you need to get to the hospital because your mother's having a heart attack. My mother was 50, and to me, I thought she was really healthy. I was like, what do you mean my mom's having a heart attack? That's not possible. But I'm in medical school, so I luckily she's in Richmond, I'm in Richmond, and she comes to the hospital where I'm actually doing my education. And I'm in the emergency department, and here she comes on a gurney, coming into the emergency department. She's there, she looks very sick, she looks very uncomfortable. And the emergency room doctor is talking me through everything that's happening with her. My mother can't even really speak to me at this point. And he's saying, you know, she's having a heart attack, and here's what we're gonna do, and I'm gonna show you the EKG. And of course, they don't show everybody the EKG. I happen to be in medicine, so they thought it was important for me to be learning. But imagine, as a medical student, the first patient I see with an active heart attack is your parent, is your mom. And so they started to show me everything that they were going to do. And that has stuck with me throughout my entire career. And understanding, you know, at that point in time, and we're going to talk about this and get into this a little bit later, that there is no prototype, there is no specific way. You can't look at someone and say that that's the person who's going to have a heart attack and that's the person who's not going to have a heart attack. And so I learned in that moment that anybody, any woman could have a heart attack at any age. So we're going to really get into that. But I'm going to turn my first question to you, Dr. Henley, because you are a cardiologist and an expert. Can you talk about why it's so prevalent in middle-aged women and in elderly women?
Well, as you know, in the USA, 1 in 5 deaths are from heart disease. So it's very important to know that, and especially in women, people feel that, hey, it's a man's disease, and it's the leading cause of death in women. And people say I'm not old enough, when 1 in 5 heart attacks are in individuals that are less than 50. And a lot of people don't understand that. And then some people feel like I'm fine, or I have these symptoms and I think it's from something else, indigestion, or I'm just deconditioned, I'm just out of shape. And then that can creep up on you, and it could actually be something wrong with your heart.
Are there certain misperceptions about heart disease that we should be thinking about, that women should be thinking about, and specifically women of color, women who are underrepresented, from underrepresented groups? What are the misperceptions?
I think one of the biggest misperceptions is that we think it's only can happen to men and older individuals. And we need to be just more knowledgeable why we're having this platform here today, is that yes, it could happen to women, right? Yes, it can happen in me and I'm 45 years old or so. So I think those are the two biggest misperceptions. And the other thing is that I'm fine, I'm not at risk. And a lot of individuals and a lot of women don't know their risks. They don't know, and in underrepresented minorities, the people don't talk about at home or in family reunions what runs in the family. And that's very, very important that we start having those conversations, especially because now versus 30, 40 years ago, there is some increase in access and increase in knowledge about what affects us, and it affects us at an alarming rate more than others. And when people die, we tend to die more.
So let's flip that around a little bit, because we talked about the perceptions from the woman's perspective. How about, we talked about this a little bit before we started, the perception from the healthcare system.
Yeah, so and that's difficult, and we need to learn. We need more women.
Yes,
in
we need more
healthcare.
women. We need more women in research trials.
Yeah, in research trials as well.
Yeah, that's right.
But the biggest misperception on the healthcare side is you look at age, you're like, oh, you know, she's young, she's a woman. We overdo it. We're super emotional. We always complain about everything, you know. And so I think from the healthcare side, that can be downplayed. And I think that's why it's important for women. We know ourselves, right? And so I think it's important to have women healthcare providers present, right? Because they kind of get an inkling, they know, and I think they can that language barrier for that gender is kind of, it's lost, right? When you have two women sitting talking to each other. So there's a connection there that I think is very important. But the biggest thing from the healthcare side is, oh, it's a woman. Oh, she may be overreacting. Oh, it's something else. It's indigestion, you know, or she may have a stomach bug.
That's right.
Yeah,
that's
or
exactly
something other than the heart. When we know statistics are statistics, right?
That's right.
Heart disease is something that impacts women more than any other disease. When you're talking about women that have to take care of kids or take care of their mothers and fathers, we do so much, especially in the underrepresented minorities for taking care of our family. And if we lose that, if that person is lost as a caretaker, that's huge, and that can be devastating.
That's right.
For
That's
a family.
Exactly. That's very, very true. I think it's really important for us to be able to share, because I think we can almost be in a situation where we would talk ourselves out of, it can't possibly be a heart attack. It can't possibly be. I'm sure. And when I talked to my mom years, after everything, the dust had settled, I said, Mom, what were you feeling in that moment? Like, what was going on? And she said, I talked myself out of it. I stood in the bathroom at my job and said, oh, it's not possible that, I'm sure it's just a minute, I'm fine. Yeah. And then it wasn't. Yeah. So let's talk, let's hear one of our friends on the couch's stories. We'll talk with you, Latoya. Tell us about you.
I can relate to your mom's story. I was at work. It was Friday, and I was feeling just not myself. I was very nauseous. My left arm was aching. It felt very, very heavy, and I think I started having that left arm ache about a day or so prior. Okay. But I pushed and I went to work, and I didn't pay it any mind. I was going through a stressful time. I had just gotten divorced, and I went to work, and I was nauseous. I was sweating, moist, and I remember going to the bathroom. As a matter of fact, I worked at the hospital. I went to the bathroom, and I just couldn't get it together. I called a coworker to come around, and she saw me, and I was like, just get my stuff. I want to go home. And she said, you're not going to drive. And I said, I'm okay. I'm just, going through a time. I'm okay. And she gave me an aspirin. Mm-hmm. I think that aspirin may have been very helpful, but I started driving home, and I had to pull over in Walmart, and I called my daughter. And I was outside of my car, and I just couldn't get it together. The arm, it was the only big symptom I had was my arm was hurting and I was nauseous. Never did I think I was having a heart attack. So my daughter didn't want me to keep driving, but I kept getting it together and I made it home. And she met me at home. We went through all kinds of things where I didn't want to be in the house. It was just, this house does it to me. Let's go. My daughter rode me around in my car. I felt comfortable while I was riding in the car in the heated seats. And I was fine. Soon as we went back home, I became in anguish again with my arm, and she said, well, let's go get a hotel. And at that point, she drove me to urgent care.
How many hours had this been?
How many?
It was days.
Wow. Days.
So she was like, we can't keep riding around. You're going to get checked out. And I went to urgent care. And they didn't take it for granted. They did an EKG immediately. And she told me I had been having heart attacks. Wow. And at that point, she wanted to call the ambulance, and I was still hard-headed. And I said, I got to go pack my bag because I work at the hospital, and I'm not going there without pajamas and stuff because I know they're going to keep me. And I had to call my boss, Dr. Teal. And Dr. Teal met me there, and from there, it was a lot.
Yes, I can imagine.
It was a lot, that's right. I mean, I think your story, though, highlights a couple of things that I want to go back on. And you were speaking to it, actually, Dr. Henley. Ignoring these symptoms, again, talking ourselves out of what it can't be, trying to distract ourselves, drive me around, let's go stay at a hotel, let's do anything other than really sort of confront what is causing this ailment. And thank goodness, you had your daughter there to say, listen, we have got, enough is enough, we've got to get this taken care of. Yeah. So talk a little bit more about, of course, I could probably fill in the detail, but you talk a little bit more about when you got to the hospital and once they realized that you had a heart attack.
So they ran additional tests when I got to the hospital, and they confirmed that I, in fact, had a heart attack. And at that point, they were going to transfer me to a higher level of care because the community hospital where I needed to get to someplace different. Dr. Till was with me. Dr. Till got in the ambulance and rode with me. I got to Christiana, and they tried to do a cath on me. Mm-hmm. And I was woke. And they said it wasn't going to work. She's 90-something% blocked, and we have to open her up. And I needed a bypass. So at that point, they rolled me back out. And my family was there all against the wall. Dr. Till was with my family. And I reassured them that I was okay. I got this. And they took me back and got me stable. Dr. Till was working on my behalf. And they stabilized me for the weekend. She didn't want me to have surgery over the weekend. And I went in and had my open heart that Monday morning. I stayed for about 9 or 10 days. I got up and I sat up in the bed that night. My best friend was here from Arizona. And she was amazed that I was up and sitting on the bed after open heart that night. And I just did really well. I got on a good regimen of medicine, and I've done well.
Yeah.
I've done well.
Yeah. Yeah. You know, do you mind sharing how old you were at the time when that happened?
I was 47.
So 47, and you know, you think with our advances at this point in time that, gosh, she had to have a bypass, right? I mean, it seemed really drastic, but because of where the blockage was, there was no way they could bypass it. I mean, there was no way that they could use the little roto-rooter to open it up. And so when we were all out in the waiting room and they said, there's no way we can do this, she's gonna have to have bypass. I mean, I was shocked, her family was definitely shocked, but I was shocked, thinking in this day and time with all of this technology, this was what she had to go through. But as she said, she came through with flying colors. And,
You're supposed to be here.
Well. You are supposed
Amen.
to be here. That's exactly right. That's exactly right. So, you know, it's funny because, well, not funny, but we've been talking a lot about, and I think, I don't think we can overemphasize the importance of these early signs. And, you know, her daughter's here in the audience, which is great because she gets to chime in on the early warning signs, right? I mean, you're highlighting days of symptoms, days of not feeling well, days of nausea, days of saying something just doesn't feel right. And show of hands, how many of us got up in the day, you know, any day and said, I just don't feel right, but I'm just gonna muscle through, right? Do we not all just do that every single day of our lives? We do that. And so let me say it this way. Don't get up tomorrow and go to the hospital just because I said that. Like, don't say, and Dr. Teal said, I don't feel good, go right to the hospital. That is not what I'm saying. But what I am saying is that if you have a couple, you know, if you have days and days and days of feeling something that just doesn't feel right, we have to start listening to our bodies as women, because as you said, we are the caregivers, we are the care providers, we are the ones that are holding the glue together for our families, for our communities, for our jobs, you know, so these kinds of things, so it's really important. So we've talked a little bit about your early warning signs. You talked about your left arm. Dr. Henley, are there other warning signs other than nausea, other things that you might think that we should think about?
So I just want to say, women, the most common is chest discomfort. I just don't want to downplay that. However, when there's going to be a time when someone comes in and it's not going to be chest discomfort, it's going to be a woman. And the arm pain is big, jaw pain is big, and you don't have to have chest discomfort. Right. And for women, upper back pain, scapular pain, and nothing else, that could be a sign as well. And like you said, just pushing, that's what we do. If you're the caregiver, if you're the main source, we just push through, right. And this will resolve, this will pass.
Right.
That's exactly but those are the things. And the nausea she talked about is definitely, on top of the list, the arm pain. But the other big thing is the back or scapular pain without having chest discomfort.
Right.
But with the back pain alone, maybe it is just something not related to the heart, but the back pain, then feeling probably a little nausea, feeling a little dizzy, those things together are highly, highly concerning for something going on with low blood flow getting to the heart.
What about if you have other chronic conditions? So for example, if you have diabetes, if you have rheumatoid arthritis, lupus, something else. How does that change the clinical picture, if at all?
So when you're having these symptoms that may not be chest discomfort again, but you're having like this upper back pain or arm pain, jaw pain alone with the little nausea, and you know you have diabetes, right? That's a big red flag, okay? And then you talk about, oh, my mother may have had something, or my brother or my sister or my dad. So individuals whose first degree family members, so that's your mom, dad, brother, sister, any, like your mom under the age of 65 or your dad under the age of 55 having a cardiac event, that you should be very, very aware of your body and having those types of symptoms and thinking about your heart.
And when you say cardiac event, what do you mean?
Like a heart attack.
Okay.
Yeah,
okay.
A heart attack or needing bypass, even if they didn't have a heart attack.
Okay.
Yeah.
Okay. All right. Yeah, it's very important. In my experience, especially with people who have long-standing diabetes,
yes.
Sometimes the only symptom is actually shortness of breath.
Yes.
I notice that when I walk from my car to the food store, I have to stop now.
Yeah.
And that is sort of a warning that something is different, something has happened, something has changed in your body, and to seek help.
Yeah.
So that's really important, especially for those of us who have diabetes.
Rheumatoid arthritis, like you picked up, and then lupus.
Yes.
Any of those autoimmune diseases, that's a different process by which you can develop like a fibrosis in those arteries and develop outside of having that, traditional plaque, which can lead to you to have heart attacks early, especially psoriasis, psoriatic arthritis. All of those inflammatory conditions can lead to early development of disease in arteries. So I get concerned about those individuals to the same extent as we push for the diabetes.
Yeah, and I'm so glad you mentioned that, because I don't know that that is a widely known fact, that people with any one of those conditions that you just mentioned, where there's an inflammatory thing happening, rheumatoid arthritis, psoriatic arthritis. So this is not just psoriasis of your skin, but it's actually in your joints.
Yes.
Lupus, those kinds of conditions, mixed connective tissue disease, they sort of can accelerate the chances of you developing a heart attack at an earlier age. So really important, again, for when we think about our younger female populations, 20s and 30s, if they're having that same thing that I talked about, I'm having a problem, I can't walk to the food, I can't walk through the mall because I'm short of breath, we have to be raising an eye to go like, wait a minute, that's something that we need to be looking into and investigating more significantly. So yeah, thank you for that. Shrita, tell us your story. She's like, I know it's coming. Tell us your story.
So my story is a little different. I have peripartum cardiomyopathy. So it really started after I had my second set of twins.
You have more than one set of twins?
So my first set, I lost my first set.
I'm sorry.
I had them at 5 months. But after I had my second set, I had them in August of 2020. In November, I took one of them to the doctors. This was during COVID, so me and my husband, I took him up to the office. He stayed in the car. But when I came back down, I put him in the car and we were leaving St. Francis. And we were talking about getting something to eat. And I just started feeling lightheaded. I started getting hot. And we're just riding down the street. I'm like, maybe it's just, again, putting it off as something else. I'm like, maybe I'm just hungry. But then I started getting too hot. And this is wintertime, so I'm sweating profusely at this point. Then I started getting nauseous. Then I had to tell him to pull over because then I vomited. And after that, I passed out.
Oh, wow.
He rushed me to Wilmington, and I'm in the emergency room, and they start doing tests. They put me on IV for liquids, and they just start doing all these tests because it's, at this point, nobody knows what's going on. So they decided to do a chest x-ray. They come back and they say, you have an enlarged heart. I lost it. I lost it. So from there, they did more tests. They transferred me to Christian out Newark and set me up with the cardiologist team there. I had to get a cardiac catheterization. It was just a lot. So I was in the hospital for a week. And I think a month before this happened, I had COVID. So they thought it might have been long-term effects of COVID. But they said it was from me being the age I was 38. And then with having the babies, it might have been too much strain on my heart. So what I know now is it started from my first set of twins, which is the shortness of breath, the swelling, and it just got put off as, oh, it's just a pregnancy. So I just kept going. And that was, even after I had the second set of twins, my feet They had so much swelling. The nurse that I had after I came home, she was concerned about that.
And this is before you even get to the hospital.
Right.
Right. So, and the function of my heart was only 10 to 15%.
Wow.
So yes. So that's how it all happened. That set of symptoms that happened all at once is what. Now, when I had the twins, I had lost all this weight. So I'm thinking it's just, oh, I'm getting back to my normal self.
Yeah.
But no, it was my heart not functioning. So.
Wow. So
Yes.
what happened after? So they find out, they keep you in the hospital for a week. What happened after that in terms of like your medication regimen, or what did they
Yeah, so
do?
they played around with the medications because I think one of them was making my blood pressure low. On top of that, I was anemic. So I had to get a defibrillator that I wore. So I had to wear that for 6 months. I couldn't pick up my twins. It was so much that I couldn't do. I was so frail and fragile, and I just really couldn't. Walking from my house to the car was exhausting. So it was just, it was a long year. Yeah. Yes.
Wait, a second time?
Yes.
Oh, geez.
Again. Yes.
Oh, geez. So fast forward, where are you now in terms of your journey?
So now I believe I'm normal. I'm still on my medications. My last echo, I was up to 50%.
Yay! Which is essentially normal.
Yep.
Essentially normal. So
Yes.
she's made a full recovery. Excellent. Okay.
Yes.
Excellent.
Yes. So I gained my weight back, as you can see.
Healthy.
Yes, yes. But I'm listening to my body. Dr. Scantlebury, let me call Dr. Scantlebury. I don't feel right.
I love it. That's great. That's exactly right.
But I did have to switch doctors because it is a difference between men and women in how they explain things and the information that you get. So Dr. Scantlebury was a blessing. So
I agree.
yes.
100%. I agree. That's an amazing story. And it's interesting because in my brain I was thinking, we want to make sure that we think about, heart disease, there's a very, very broad spectrum. And when we think about, often when we think heart disease, at least when I think of heart disease, I think heart attacks, right? Heart attacks and strokes and so forth. But I think you really highlight another very important part. Can you talk a little bit about postpartum cardiomyopathy, what it is specifically, and how it affects young women of childbearing age and women of color?
So many of the symptoms that she described were the early warning signs where you get home, right? Because when you get in the hospital, it's so funny because I've had a couple, so I kind of know what happens, which is important why you need more women taking care of patients, is that you get this IV, right, hooked up when you get in there to the labor and delivery. You may labor for 4 hours, you may labor for 48 hours. You got this fluid running, right?
Yes.
And your body changes while you're pregnant until you give birth. And then it changes back. And as it's changing back, well, let me go back. When you're pregnant and you're going through pregnancy, your vessels become very compliant, right? So your blood pressure may drop some. And then when you give birth, those vessels are not as compliant, they come back, they're more stiff. And if your body is able to handle all the fluids that you get during the labor and delivery, that's a beautiful thing. But some people can't. Some people develop the swelling. Many people develop swelling and it goes away by itself. But some people develop the swelling and it stays. And I think sometimes it's written off that, oh, you just had a baby.
Yes.
And I think we need to be more, I think this is very important that you're on this couch because we need to be a little bit more aware, a lot more aware of, okay, this is not leaving, or even going to just get checked out about it. But with the postpartum cardiomyopathy, or we call it peripartum. It can start before or after giving birth. And typically, the swelling is a big thing, and then the shortness of breath. And it's just a thing where you have to fall off that cliff because people are so young. That reserve that young people have is amazing. So once you fall off the cliff, and she didn't fall off the cliff until how many months later?
What's that? 3 months.
3 months later.
Yeah, right.
Right? And what was the thing that helped her fall off the cliff? The COVID may have helped her fall off that cliff. And once you fall off the cliff, you're circling, and you have to get to seek medical care almost immediately. But that's how that works. So about a third of individuals get better, right? And I'm so happy that she did. Yes. When your heart function goes to 10% or less than 30%, we consider to be severe. And then you wear this life vest to help prevent you from having it treats cardiac arrest. So if your heart were to stop from a lethal rhythm, it'll shock your heart back until your body heals, time and medicine, right, to help support your heart. And then about 3 months after, we take another picture. What does the heart look like? If the heart is still weak, we offer a defibrillator. If the heart is strengthened, we take that vest off, right? And we move forward. However, when we talk about getting pregnant again, we had that conversation. I was like, twins. It's gonna be twins. And she was like, oh, we're done. But there are a lot of women who want to have babies.
Yes.
You think about young women, 20-something years old, somebody telling them you can't have babies again. Because I always ask, do you want to be pregnant or do you want a child? Those are two, and it's a very important question. Those are two different questions. Some people like to be pregnant. Some people just want a child. If you just want a child, we can help out. There's
other ways to help you.
There's other ways, but some want to have their own child, right? They don't want to use surrogate. And that, once you've had it, it places you at a higher risk to have it again. Got it. And trying to support a pregnant woman in that setting is very, very difficult because we can't give them the medications to support their heart during that time.
Wow. That's amazing.
Yeah.
So much.
Yeah, so much. Yeah, that's a big...
Friends in the audience, questions? Do we have any questions from the audience right now? Yes, ma'am.
You mentioned signs and symptoms. You mentioned signs and symptoms. I'm curious to know what the upper back why would that give me an inkling that I could be potentially having a heart attack?
So the way the heart is, the nerves in the heart and where it can radiate to, depending on the artery, you have two major arteries that come off and then one branches off, right? So typically what I've noticed is the ones that gives you the back pain or the top of the right shoulder pain or the scapular pain tends to be the one that feeds the bottom of the heart, right? And it's just the way the heart is innervated and where the heart discomfort can radiate to. So the radiation is typically up to the shoulder, arm, and it could be right arm too, or up through to the back. Okay. It's just unfortunate the way it is. And
I asked that question because I constantly have upper back, and I do have a condition. They have not diagnosed me. I have a very rapid heartbeat. It's very rapid. I've passed out a few times because of it, probably scaring myself more than anything. I can't get my breath. But when you said the upper shoulder, I thought about that. But I mean, I'm not in any harm of heart attacks or anything like that. I was just curious about that.
But yes, I get some primary providers, they get concerned because they know this to be a symptom. So I get consults of patients like, I just have shoulder pain. My doctor wants to make sure my heart is okay. So we go through a whole exam just to, and kind of get a spiel. What's the risk factors? And then is this something related? Are you having any shortness of breath with it? When you go up the stairs, like when you exert yourself, if you're in an argument with a friend or a coworker or you're stressed at work, does it come on? That's a red flag for me. Or when you lift your hand up high, can you lift your hand and pat your back? And when they're like, oh, that hurts, I feel so much better.
There you go.
Thank you.
Yeah, no problem.
That's your test. If you can touch your back, probably not your heart. That's good. I like that. Yes, another question over here.
So you mentioned that you were anemic as well. So, and also midlife, right? Our hormones What has anemic and premenopausal or menopausal, how doctors, could you help on how that impacts the heart disease for women?
So as far as the perimenopausal period is, it's interesting, right?
That's a polite way to put it. That's a really polite way to put it.
It's interesting because you can have all of these little symptoms where it is like, is the wall moving or am I moving? You know, the slight dizziness, right? The palpitations is big thing with the heart rhythm and the hormonal changes that goes on. So I get a lot of those in. And some might get with the hot flashes and things of that nature. The anemia in the heart, you know, the hemoglobin that carries oxygen, right? So that's very important when we talk about heart health. So we want the hemoglobin to be normal in those situations. And then you have women that have a topic that we're not going to discuss with the smaller arteries that we can't even really get to and treat that have disease. We call microvascular disease. In the setting of having something like anemia is very important that it needs to be addressed and treated in order to, you know, make that person whole.
The other piece that you started to talk about is that going through the menopausal change also changes your risk factor profile. So, you know, when you're making estrogen and everything's great, you know, you have a really good cholesterol profile. Your good cholesterol, your HDL tends to be really, really good. Your bad cholesterol, well, that could still be bad depending on your diet. But generally, the good cholesterol prevails and it's heart protective. But as you're going through menopause, that ratio changes, and so you start to have much more bad cholesterol. Your good cholesterol lowers. And so your risk factors start to go up the older you get, and especially if you go through menopause at an earlier age. So these are some of the risk factors that can accelerate that process for you. For my mom, for her, she went through menopause early. She went through it at 42. She was also a smoker and in a very high stress job. So, and then she was on hormone replacement therapy, which you can remember in the 80s, you know, is do you do it or you don't do it, you know? And so it sort of created this perfect equation for her to be a setup for having a heart attack. So yeah, so menopause definitely can impact your cholesterol profile, which then impacts your risk factors for heart disease.
So having said that, what are the top 3 signs that one can look for like an alert or an alarm with anemic, menopausal, premenopausal for a heart concern?
Ask the question again. I'm not sure if I understand.
So what are the 3 alerts in this time frame of midlife that women should be like, if I'm anemic, I am anemic.
Oh, if you're anemic.
Is that something that I need to?
I would think there'll be other risk factors that are higher on the list than anemia itself. I think, you know, for your whole total body health, I think anemia has to be addressed, right? But I wouldn't put it in the top as far as for cardiac disease.
Right. I mean, unless you decide that you're going to become like some marathon runner or something like that, because when you think about it, and seriously, I mean, a lot of, you know, women certainly start at a different stage in their life and say, this is what I want to do. But you think about anemia is where you don't have, usually it's because you don't have enough iron in your blood. So iron helps carry oxygen. Oxygen is carried in your red cells. If you don't have enough red cells or you don't have enough oxygen on those red cells or in those red cells, then you're creating stress and strain in different parts of your body. One of them happens to be the heart, but that can be it can also be your kidneys. It can also be your nerves in your hands. It can be your brain. It can be different places. So you do want to address, and as I agree with Dr. Henley, I mean, it's probably not a top risk factor unless it's acute blood loss, like an acute anemia. Then you could definitely, meaning like you suddenly lost blood and you suddenly don't have the ability to get enough oxygen to your heart. That's when there's a risk factor. But if it's chronic in nature, probably not in the top 3 in terms of risk factors. Yeah.
So in speaking on heart disease, with Sharita getting pregnant in her late 30s, having a set of twins, and then turning right back around and getting pregnant almost 9 months later, 6 months later, when the doctor clearly told her she needed to wait a year.
No, he told me 6 months.
Oh, 6 months to a year.
In a day, right?
Six months to a year. I was in the room.
I know what I heard. I know.
Yes,
Right, yeah,
yes.
gotcha.
6 months to a year.
Yeah, I love it. That's great.
And because I had all these questions when I was in the room because of what she went through, you know, the depression and everything with losing those twins, I certainly wanted her body, mind, mentally to heal before she decided to have other children, and then to turn around and get pregnant at 6 months only to find out with twins again. That right there certainly had a whole lot to do with her heart and her body and everything else. So when you turn around and have children, well, she twins and then twins again, that could play a big part on the part of her heart being so stressed out.
Oh, most definitely. Most
Okay.
definitely, because you went 5 months, right?
6.
No, not the way. It was you were the first set of twins, 5 months.
Yes, 5
Went
months.
5
I
months,
had
which is
20.
yeah, because you were at second semester, right?
Yeah.
So that's a long time to carry, and then you know, for your body to try to heal and not knowing what was going on with the heart, because did you have the swelling after with the first set?
I did, and I still had the shortness of
So breath, yeah, and not knowing, right? So definitely that was an additional stress.
I asked because I know when you ladies were saying, do we, you know, sometimes not pay attention to our bodies? And I was always one that as soon as I got a cough, I was going to the doctors. As soon as my children had something going on, a little bump, I was taking them to the doctors. So Sharita used to say, Mom, please calm down. You know, but I just believed in, you know, I'm walking around and everything is fine. And then all of a sudden I start feeling some kind of way, or I see my children, you know, coughing or whatever. So I want to make sure that everything is okay. So I was really concerned about her after she lost the first set of twins, and then knowing how much she wanted a baby, only to turn around and find out that she was pregnant again with a second set of twins to go through everything. So when things started happening with her passing out because her husband found her in the car, you know, she had gone to the car because she wasn't feeling well, and then she got in the car and she couldn't move. He went out there to find her, you know, and this was
later.
This was the second time.
This was the second baby.
Episode
last year.
Yes.
Yeah.
Yes. You know, so. And then when she went to the hospital, they sent her home, and she couldn't walk. I mean, she could barely walk, and everything was going on. So it was a lot going on with her body, and I just.
And that, I mean, that goes back. You brought up a very important point that we brought up earlier. Was you're young, you know, this can't be happening to you, and then sometimes symptoms get dismissed. And gratefully, you're supposed to be here.
That's great. That's
because
exactly
it could have been different.
That's exactly right.
It could have been different.
Yes.
Was there another question on this side? I thought, yes. Oh, okay. Pass that down.
So I believe we both have a vested interest. With Sharita being your daughter and LaToya being my mom, you picked up on something that I wanted to pick up on, that stress. My mom just went through a divorce. You had just gone through a traumatic loss. Can you all talk more about how the stress and the heart disease is related? As a mental health therapist, we talk about everything being connected, but I just want to, I guess, talk from a clinical perspective more on how stress and heart disease can be related. And then twofold, before my mom started having these symptoms and complaints, heart disease wasn't something that was known in our family that we had experienced before. So it wasn't anything that was very prevalent. You might have heard, oh, we're at a higher risk, but it never really was relatable, I guess, for me. So how do we increase people's awareness, this platform being one way, but what are some other ways that we can really help individuals to connect to them having that higher risk and increasing their awareness?
So the one thing you mentioned is mental health, and you know, I talk about that a lot when I talk with my patients. I think it's Very important. I want to know who's at home, who are you taking care of, who's taking care of you, because that will impact my conversation when you come in. How are you doing? You know what I'm saying? Outside of the medicines that you need to be on and your blood pressure, how are you doing? Because mental health, I've seen individuals come in from an argument with a heart attack. I've seen people come in I have to take them out of work because at work their blood pressure is 200 over 100, but at home their blood pressure is 120 over 80, which is where we want it to be. So mental health is very, very important because women, the world is on our shoulders. It's just natural, I guess. It impacts us the worst. And I think we hold up and compensate the most until we fall off the cliff. So the mental stress and mental health is important, being able to have directed journal entries to attack anything that may be your triggers from first grade, second grade to an adult. It's very important because the emotional intelligence and self-awareness is prime. If you do not have that, that can eat at your core. Mental health does cause organic disease. It does. I can't argue that it doesn't at all because I see it in my practice.
Yeah, and I don't know that there are a ton of quantifiable studies. Like I don't think we're going to stand up here and start quoting academic stuff because quite frankly, I don't know that it really exists.
Right.
But we certainly know, as Dr. Henley said, that stress hormonally changes your body. We know that your cortisol goes up. Cortisol is inflammatory, causes inflammation in your body, and so all kinds of different things are happening when you have inflammation in your body, right? And it kind of goes back to the question about menopause. We know your hormonal balance has changed at that point in time as well. None of them for the good, like nothing for the good, unfortunately. So, we know that there is, I tell people when they come into the office that we're all a big walking pie chart, right? And we'll talk a little bit more about this later on, but part of you is diet, part of you is genetics, part of you is lifestyle, and then there's part of you that's stress. And everybody's cut up of that pie is different, right? And it can fluctuate depending on what is happening, as you've said. You don't know, and none of us can really appreciate the magnitude of what stress does to us, or what situations may be stressful for me and not stressful for you, or for you, or for you, or for anyone else. So it's not necessarily quantifiable, but we certainly know that there are opportunities to kind of learn your limits, because you're saying, like, how do we educate? How do we tell other folks? We say, listen, stress kills.
It does.
Full stop. Stress kills. And I shouldn't have to convince you, right? Right? We have people sitting here who have been through stressful situations, who are here to talk to us about, don't let it get the best of you. So we have to start now, really in a preventive fashion, of thinking about, I know I'm about to walk into a stressful situation. How do I de-escalate that stressful situation? How do I remove myself from that situation? Or how do I remove myself, even if you can't do it physically, how do I do it in a way that my blood pressure is going to come down, my heart rate is going to come down, right? Because you know what happens when you have stress. You can check your pulse, right? Oh, it's going really fast. Oh, I feel the blood going up to my head. I know that I'm stressed. So we know that there are physical symptoms that we can feel. We just need to be attentive to listen to them, step back from a situation and say, okay, I need to do something differently, and to talk and to share. I think Dr. Henley started this with, we go to family reunions and we don't talk about what's been happening in our family generations-wise, because it really may be in your family, you just don't know, right? That's one thing. The second thing is, when you're talking to people, really be genuine. How are you? Like, how are you? And it's okay to say you're not okay.
That's right.
But it's not okay to walk away after you ask the question, because you got to stay into it in that moment, right? You have to say, is there a way that I can help you in that moment? And that's really, really important. It is really having open and honest dialogue, recognizing when someone physically looks like they are stressed, helping them to get away from a situation and helping them to learn coping skills, to see a mental health therapist or a counselor so that they can learn, they can get their toolbox, if you will, that stress management toolbox. Say, all right, I'm in this situation. Where's that tool that I need to like bring this down, take it down a notch? Because if we don't do that, if we don't start doing that, we will have more and more conversations like this where people don't make it. My mother is alive, by the way. She's alive and kicking, right? But Latoya is alive. And Sharita's alive, and so many, and maybe some of you even are heart disease survivors. But it's one of these things where we need to learn. I don't need to go through what you've gone through. I believe you, and we have to learn from what has happened with others, and then share that information willingly, openly with others. I hope that helps to answer some of your questions. What about you guys? What do you think? How else do we need to do it?
I totally agree with what you said. But I just, again, you just tell everybody they have to, listen to your body and look at the signs and go get seen. But I agree. You just ask how they are and be in the moment.
Yeah. What do you say?
I agree, and I also think talking about things and not internalizing so much. I was your executive assistant at the time.
So you're making me look bad.
It wasn't about work.
And it was you. Oh, now we understand.
But I didn't talk to you about it. I didn't talk to you about it.
Yes.
So you didn't know I was going through at work.
Right. That's true. Right.
And I actually went through at work and went home. So I didn't talk about it.
That's true. That's right. Yeah. So very, very important for all of us. Let me ask you this. So we've talked about stress. Remember I told you about the pie chart. Can we talk a little bit about diet, lifestyle? But before we get there, let's go to genetics. What do you think?
Like I said before, if you had a first degree relative, the mom less than 65, dad less than 55, and they had a cardiac event, heart attack, stroke, right? Still in there, or heart failure, then you're at risk. You're at risk. The one genetic thing that's on the radar right now, and it's prevalent, and especially in African Americans, is LPA. LP(a), if it's elevated, you can't exercise it away, you can't eat it away, you can't mental stress it away. However, it's good to do those things, but that lipoprotein, A, if it's elevated, you're at risk for heart attack, stroke, and even heart valve disease. And it's a player that's on the rise. We're trying to get more and more awareness out about it with the AHA and other organizations, Association of Black Cardiologists as well. There are currently clinical trials going on for it. And hopefully this medicine will help. The statins don't help this level come down. And it's important because this is more important than their cholesterol profile. If this level is elevated.
So who should get that test?
Everybody.
Really?
Everybody, and I feel like everybody should get it, and it's genetic, right? So if yours is elevated, reach out to your closest relatives around you.
Wow.
And they should get it too. I have a cousin who was having angina type symptoms, and she had coronary disease, and hers was significantly elevated. And I said, everybody go get your LPA check.
Wow.
Yeah.
Question. Is that a test that's covered by your insurance?
It should be covered by insurance.
You have to have a family history before they pay for it.
I have not had anyone have an issue getting it. But insurances, they can change, especially if it's becoming more knowledgeable. So if it's becoming more knowledgeable, as you know, insurances can change. But if you have a family history, or you can say high cholesterol or hypertension, those kind of risk factors, diabetes, or a family history of stroke or something like that, I check it.
Is there an age that you should start screening or getting that test done for patients?
I mean, as soon as they hit you, because usually, how old are individuals when they come to you as an adult? Typically, in their 30s,
20s.
Okay.
Yeah, in their 20s.
Yeah. If you got a 20-some-year-old and their family member had an event, I would say stroke or heart attack, I definitely would check it.
And it's a one-time test in their lifetime?
Yeah, and for now it's a one-time test.
Okay.
So you can see, they have seen some decreases with certain, the PCSK9 inhibitors.
Okay, yes.
But I tried to get some patients on that with that, and it wasn't successful because it's not indicated directly for that. And the statins can a little bit increase it, so.
Yeah, okay.
Yeah.
Wow, that is some great information. Yes, ma'am.
I have another question. Because of the pandemic and many folks were working at home and we've transitioned to jobs and we sit a lot, and now we hear that sitting is the new smoking risk or equivalent. So how do we get each other off the couch and moving a little bit more?
Standing desk. Get a standing desk in your home. Get a standing desk in one of those little cheap treadmills.
Those little walking treadmills.
You can walk while you work.
Yeah.
Take a break. Go outside. Walking outside, guys. Mental health, spiritual health, your physical health is so important. And not listening to any music, not listening or talking on the phone. Listen to the birds chirp. Let the wind hit your face. It's absolutely amazing. And so if you work from home, get that 15-minute break, walk around the block, and just, get out and move. Because as you said, sedentary lifestyle is huge. It's huge.
Yeah, so that's where I was going to go next. I'm so glad you said that, because I wanted to say, and thank you for prompting that question about sedentary lifestyle. I think the American Heart Association may have said 150 minutes per week is what we're looking at in terms of exercise. But what's real? What do we really need to be telling people? Like, how many people exercise at least 5 times a week? 5 times a week? 4 times a week? 3 times a week? 2 times a week? Once? And you just think about it. Everybody at least thinks about it, right? Even if you don't do it. And so it's really important that we talk about that piece. And can you talk a little bit really about the impact of what you just said? Because I said the pie chart, diet, lifestyle, genetics, stress, right? Exercise. Can you talk a little bit about the impact of that?
I think the exercise, right, you get good hormones. And those good hormones are good for your body. Now, women, as we age and we get in that perimenopausal period, doing cardio is not helpful for us because those hormones can actually have a negative feedback. So I actually tell my patients in the 40s, the biggest thing is to build muscle to support your joints for the next decades. And if you do that when you're in your 30s, 40s, your body will thank you later. So the resistance bands, which you can do at home, right? They're cheap to buy and do some resistance bands workouts. That'll put you in a fat burn zone because, like I said, you don't want to be in the cardio zone for too long. And building that muscle, I think is very important. So I think we should do that. Walking, like I said, is important. A 20-minute, 30-minute leisure walk is fine. I know it's cold, so nobody wants to be outside, but the summer bodies are going to be made in April.
That's correct. Right? They're now. Like you need to be working now. You need to be working now.
During the commercials,
yes, exactly.
During the commercials of your
right.
series,
yes. Exactly. That's exactly right. Any last couple of questions that you might have for the panel? Yes, ma'am, in the back.
I've been hearing you speak about menopausal, premenopausal. In the case of you had menopause at a very early age because you had to have a hysterectomy. Is it possible when you're older you can still go through some of the things of menopause?
If they leave
It's like it comes back and recycles around, although you've already been through the change and everything at a younger age?
It depends. If they left the ovaries eventually stop to work, and therefore you will go through menopause.
So they took the ovaries. So
they took everything.
Yes. So I thought it was like mental, like in my mind, and stress, related, because I started going through the changes and the heat and the flashes and all, like now in my 60s that I thought I had already went through in my 40s.
Right.
Aha.
That could be an exception to the rule kind of conversation. We'll have to talk after. I have to learn more. But your story is not completely completely unusual because I think I've heard the same thing from patients who have had total hysterectomies. They're thinking, I have nothing left. How is this happening? Maybe there's, that's the beauty of medicine. We're always learning more things. So for all we know, there may be some other place in your body that is sort of no longer working or turning off a switch that says.
Or tricking me.
Or tricking you. That's exactly right. That's exactly right. So
Okay, thank you.
more to come. We don't have the complete answer to that, but we will work on that for sure.
Okay.
And I think you had a question back there. Yes, ma'am.
I have two questions. One, when do you know to advocate for yourself, right? When you go. Sorry, she was so committed. When we go to our primary care physicians, I'm a woman, I'm 41. I'm learning to accept that. I'm 41 years old, and I will bring some concerns to my primary physician and say, hey, like, I'm experiencing these things. It appears to be perimenopause, hot flashes, weight gain, breast pain, joint pain, high blood pressure, which was something I was very embarrassed to talk about a few years ago. But now I'm just like, okay, Kina, this is what you have to deal with. But then at what point do you start to push past and advocate? Because it'll say my response or his response would be, you're too young. We're too young to have the conversation about perimenopause. You're too young. We're not really looking at that right now for menopause. So even with things like a heart attack, all the symptoms that you guys described, I am a very spiritual person, so I will just anoint myself, but I felt the left arm pain. I felt the the chest pains, shortness of breath. I went through all of those experiences and would just go and pray. Right? Because in my mind, I'm too young to even have these thoughts or conversations about heart attacks or even, as I said, like perimenopause, like all of these things, you're just kind of stuck in this age bracket to say that you're too young, so it must be something else. So when do we push and say, I actually want another opinion?
Sure. Starting today. And the reason we say that is because, it's funny, we think about our training. Our training is almost like based on decades, right? We all think about, this happens and this, you were 38 having children and now they coin it geriatric pregnancy or something. Like that is mortifying to me, quite honestly. But anyway, so, they have these different, so there's like, you're supposed to bear children in your 20s and in your 30s, you're supposed to raise them. And in your 40s, you're supposed to be stressed and that's okay, you're stressed. And 50s, maybe you're gonna go through menopause. And 60s, finally you're going to be on calcium replacement. Like all these things that they have. And unfortunately, I think it's our medical system that promotes this sort of decade-based, these are the things that are supposed to happen. But there is no one size fits all, and all of us are unique and all of us are different. We were talking earlier about one of the first cases that we ever heard about a woman having a heart attack. She was 30, she was in Chicago, sitting in an emergency department saying she had chest pain, and they told her to just have a seat because they didn't believe her because no 30-year-old would have chest pain and have a heart attack. And by the time they called her, she was dead in the chair. So like that's one of the earliest remembrances I have of don't ever try to pigeonhole anybody about their health care, their health disease. And so I would challenge you to do the exact same thing. There's no such thing as, based on your age, you can only have certain number of diseases or certain things that can be happening to you. And if you don't feel like you're getting the answers or the responses that make you feel satisfied, you use your feet to find another provider. Because it's no longer acceptable to be pat on your head or pushed aside or ignored or talked down to. That's not acceptable any longer. And so if that's not what you're getting, then you vote with your feet. Simply put, you vote with your feet. And you don't have to be confrontational. You just say, thank you for your time, and then you don't show back up. You go see somebody else.
That's true.
That's it.
So.
Thank you. And then my other question is, as women, we have a primary, we have a GYN. Should we have a cardiologist? Is that
well, Dr. Henley would probably tell you yes.
When should you then seek, certain specialists?
Sure.
So usually it's your primary care physician pushes you there. If your primary care physician, you don't feel as engaged because, some people work in a system where you're on a clock and you're part of an assembly line. Unfortunate, and that's unfortunate, right? And I think that's the conflict of interest of living in a capitalistic system like that. However, if your primary care physician sends you over, or if you know, hey, my dad, my mom, my sister, my brother, my mom's dad, my mom's dad, mother, whatever that is, if there's heart disease in the family, I would think, 35,
absolutely.
be a good
It would be a conversation
decision.
that you should be having with your partner where they're assessing your risks.
Exactly.
And so if you have this family history, as Dr. Henley said, then they should be saying, I think it may be a good idea. If we personally are not doing the testing ourselves, like you said, the lipoprotein, checking your cholesterol, checking some other things, maybe even putting you on a treadmill, checking you out, then the next step would be to see a cardiologist.
But like you said, the primary care physician should be able to do all of that.
That's right.
They should be able to do all the screenings.
Exactly. No, this is not self-serving. It is because we really want people to be their best. You are your best advocate,
That's
no
true.
matter what. Hands down, you're always your best advocate.
That's true.
Yeah. That's true. Awesome. I think. Oh, one more. Okay.
So if someone has hypertension and they've had it for a couple years, should they be just followed by primary care or should they see a cardiologist at some point?
So I always thought, and I still feel this way, I feel like kidney doctors are the best, antihypertensive, the best doctors to treat high blood pressure. I just personally feel that way. Yes, I treat high blood pressure as well, but that kidney component, if it plays a large role, the kidney doctor, you don't have to have kidney failure for that kidney component to play a large role there. But I think if the primary care physician can't get it under control, typically they do send you off to a nephrologist and or a cardiologist to get that control.
Generally speaking, if your blood pressure is well controlled, there's no need to be referred. It's only in the instances, or usually, I shouldn't say only, it's usually in the instances where it's either hard to control or something changes. All of a sudden, the medication regimen isn't working for you or something has changed. And it's more challenging to be able to take care of it. Or in the case that we talked about family history, you have high blood pressure in the setting of a family history of kidney disease or with heart attacks or strokes. Then it may be prudent to have a specialist weigh in on, are there other things that we need to be looking for that we should be treating or making sure that we're taking care of at the same time that we're treating your blood pressure.
Thank you.
Sure.
No problem.
Sure. I see one more. Yes, ma'am.
Yes. I'm in my 50s now, closer to 60. My younger brother in his 30s had a heart attack. My younger sister in her 30s had 7 strokes.
Wow.
And should I be concerned? Yeah, I've had the stress test and they're saying everything is okay. But that was about 10 years ago.
I think that you're getting this, if you're getting the screening test, your cholesterol is being checked. LPA.
I was just about to say.
Remember that LPA.
I don't think I've ever had that test.
Right, and I think by the time it hits primary care at a high rate, it may be years. You guys are on it now.
Yeah, we're doing it. Yeah.
But it may be a while. But in the specialists, we're definitely are on it. So LPA, you can ask your primary care. Just say, I talked to a doctor face to face, a cardiologist, and she said, you have family history at that young age. Most definitely get that LPA
and a
check.
cardiac CRP.
Yeah. CRP, yep.
Yeah, definitely.
ApoB too, yep.
So there are definitely some tests to anticipate your risk factors.
Yes.
And you just want to make sure that you're getting those tests done.
Yeah.
We can certainly give you a list after.
Please.
So that way you can go into your right, armed and loaded and ready to go. Exactly. Right?
Thank you.
You're
Thank
welcome.
you for coming.
You're welcome. Thank you.
That
That is
was
a very good one. All right. We've had a full evening of conversation. I hope you've learned some things, everybody. Yes? Awesome. Yeah, I've learned some things. That's what I love about medicine. I'm always learning something. So thank you very much to our guests, LaToya, Dr. Henley, Sharita. Thank you for sharing your stories. They really are very inspiring, honestly, not just for those folks out here, but honestly, I think for us as doctors to see you all up and thriving, it's really, really huge. It's all about medicine. It's all about care. It's about love, and it's about community. So thank you, everyone. Thank you for coming. We are deeply appreciative of you all, and we look forward to seeing you again. We thank our friends here at DETV, because without them, we wouldn't be able to do this. Thank you for turning into Every Woman's Her Health. Till the next time, stay healthy, and remember, self-care includes taking care of not only what people see on the outside, but especially what's inside of you. We'll see you next time right here on Every Woman. Bye now.